The Trump administration sent shockwaves across the nation in early February 2025 with a series of sweeping layoffs affecting thousands of federal employees. This drastic move, spearheaded by the controversial Department of Government Efficiency headed by Elon Musk, aimed to slash government spending and streamline federal operations. The administration argued that these layoffs were necessary to eliminate bureaucratic bloat and inefficiency. However, critics saw it as a politically motivated attack on the federal workforce and vital public services. The layoffs targeted a broad spectrum of government agencies, from scientific research institutions like the National Institutes of Health and the Centers for Disease Control and Prevention to regulatory bodies like the Federal Aviation Administration and the Environmental Protection Agency. Even the venerated U.S. Forest Service and the Department of Veterans Affairs were not spared. This sparked widespread fear and uncertainty among federal workers, many of whom faced the prospect of unemployment after years of dedicated service. The administration offered a voluntary buyout program as a precursor to the layoffs, hoping to mitigate the impact on the workforce. However, the response was lukewarm, with only about 75,000 employees accepting the offer. This fell significantly short of the administration's target, forcing them to proceed with the planned layoffs. The Department of Defense and the Department of Homeland Security remained largely untouched, raising questions about the criteria used to determine which agencies and positions were deemed expendable. As layoff notices landed on desks across the country, a wave of anxiety and anger swept through the federal workforce. Unions representing federal employees denounced the move as reckless and counterproductive, arguing that it would cripple essential government functions and harm the very people these agencies were designed to serve. The stage was set for a protracted battle between the Trump administration and its critics, with the livelihoods of thousands of Americans hanging in the balance. Among the many agencies targeted by the Trump administration's cost-cutting drive, the National Nuclear Security Administration and the Indian Health Service stood out, raising particular alarm among lawmakers and the public. The NNSA, responsible for safeguarding the nation's nuclear arsenal and ensuring its safety and reliability, faced significant staff reductions. Initial reports suggested that nearly 300 employees out of a workforce of 1,800 received layoff notices. This sparked immediate concerns about the potential impact on national security and the NNSA's ability to effectively carry out its critical mission. The IHS, tasked with providing healthcare to Native American communities across the country, was also hit hard by the layoffs. Roughly 950 IHS employees, many of whom worked directly with patients in tribal communities, were informed of their impending termination through a curt phone call. This sparked outrage and fear among tribal leaders and healthcare advocates, who warned of dire consequences for the health and well-being of Native Americans. The IHS already faced chronic underfunding and staffing shortages, and these layoffs threatened to exacerbate an already dire situation. The decision to target these agencies, both entrusted with sensitive and vital responsibilities, baffled many observers. Critics questioned the administration's judgment in prioritizing short-term cost savings over the long-term health and security of the nation. The layoffs at the NNSA raised concerns about the potential for brain drain and a loss of institutional knowledge crucial for maintaining the nation's nuclear deterrent. Similarly, the IHS layoffs threatened to worsen healthcare disparities and jeopardize the trust between the federal government and tribal nations. As the news of the layoffs spread, a chorus of condemnation arose from both sides of the political aisle. Lawmakers from states with significant Native American populations and those representing areas with NNSA facilities voiced their strong opposition to the administration's actions. They argued that these layoffs were not only short-sighted, but also potentially dangerous, putting the nation's safety and the health of vulnerable communities at risk. However, on Friday, February 14th, the government started reaching out to the fired staff of NNSA and the Indian Health Service, recalling them back to work to mitigate the workforce shortages that the mass firing of staff had created. The aftermath of the layoff debacle has left many employees in a state of uncertainty. The ripple effects are being felt across various departments, causing disruptions in workflow and morale. With trust in the administration dwindling, the road to recovery seems arduous. The layoffs have far-reaching consequences for federal workers and essential services. Many government employees are now grappling with job insecurity, and critical public services are at risk of being undermined. The potential impact on the community is profound, as essential services are the backbone of daily life. The future remains uncertain, and the need for a robust support system has never been more evident. Please like to ensure this information reaches those being recalled and subscribe for more videos like this. Thanks for watching.